Hello viewer and good day to you. My name is Betty Akuku and I'm your host today. I am joined by a doctor you must have met before, and today we are talking about preventive tests for cancer in women. When you hear about cancer, of course, there is the obvious scare and fear that comes to you, thinking that cancer is a death sentence. And so we know that there is breast cancer, there's cervical cancer, especially those that affect women. And today we want to narrow down to this that are just prone to women. When you hear about cancer, everyone is really scared. But today we have a solution, and this is what we're going to be talking about. How can women escape breast cancer and cervical cancer? I'm joined by this famous doctor. Please introduce yourself and take us through this discussion.
Great. So thank you, Betty. My name is Steve Adjudants. I'm a medical practitioner, and I'm passionate about wellness, health and wellness, especially when it comes to chronic diseases like cancer and hypertension, diabetes. Work with Gear Health Systems, where we make it easy for families to be able to get health and wellness. Asante.
All right. Welcome and good to have you, Dr. Steve.
Asante. Yes.
All right. It's always a pleasure to have you, because when you come here, you teach us a lot of things that you need to know, especially women who are above the age of 40,
Yes.
those who are 20s and 30s just growing up, because cancer, I don't know whether it actually respects the age, but I have met with a doctor who told me that the youngest patient is 12 years old. That was really sad, and so I don't know how that happens. But you are so passionate about wellness that you have poured all your heart to do this. I wonder what your drive is, especially to the woman.
Now, it's true what you're saying, that cancer nowadays, it does not just occur at an older age. Cancer can occur at any age. And when we do understand how cancer is caused, then we're able to actually know how to prevent it.
True.
Now, for majority of cases, cancer is caused by the lifestyle that one lives. So if one changes their lifestyle early enough, then they're able to prevent a cancer.
Oh my God, that is just like what people hear a lot.
Yes.
What people know. I don't know why they don't do it, or
Yes.
there is a different way to just apply lifestyle.
Yes.
When people talk about lifestyle, all you hear is diet,
Yes.
exercise, don't do this and don't do that. But all those things you're telling people are just like the law. They're so difficult to apply.
Yes, you see, the diseases are divided into two. They're what we call communicable diseases, meaning that those ones are spread. They're usually infections. They are spread by contact.
Yeah.
So contact can either be physical contact, somebody probably sneezing on you, or even sexual contact. Those are communicable diseases.
All right.
Then you have the non-communicable diseases, and this is where cancer falls. These are diseases that one gets not because of physical contact, but because of the lifestyle they live, or anything that is exposed to them other than the pathogen or the viruses or bacteria that they get from somebody else. Okay. However, interesting enough, and we shall be talking about this, of why women, is because cervical cancer is one cancer that is caused by an STD. So it's become very difficult because
STD, which
yes.
would mean the man has transferred it to you.
Yes, we are the culprits. We are the culprits. At least 90% of cervical cancer cases, there is a virus known as the human papilloma virus.
Yes.
Is implicated. Yes, and it's
So the man
transmitted.
carries the HPV from another woman.
Yes, it's a sexually transmitted infection that we pass around.
Oh my
Yeah,
God.
yeah. So interesting enough. Yeah.
So it's not that it just comes from the woman.
No.
You must get it from the man.
Yeah, yeah.
And can the man then be tested
Yes.
to find
can.
out whether they have it or not before
Yes.
you can get into contact?
You can. The test is there, but it is not readily available in all the public institutions. Yes, but yeah, one can be tested. But what is much better is for vaccination for women. Yes, yes, yeah.
Because when you have the vaccine, does that keep you away? Vaccines don't like keep you away from contacting a disease. It just makes it easier for you when you finally do.
So we can look at vaccines in different ways because vaccines are different types. Vaccines are usually there to boost the immunity so that when the infection comes, then one is able to fight it. Okay. So what happens is that for the different types of vaccines, especially the viral based vaccines, we usually inject an inactivated part of the virus into into the person who's being vaccinated, and what happens is that they mount an immune response against that particle, so that the body learns. So the immune system in our body is like a university. So the cells actually learn. So they're like the army. So they are taught, whenever you see something like this, fight it. Whenever you see something like this, fight it. And then they go to the parts, what we call the lymph nodes. And the lymph nodes are usually the places as well whenever we have an infection. So it can be around the throat, around the groin. Those are the places, some of those lymph nodes well, yeah? It is because usually the lymphocytes or the white blood cells that fight are usually increasing in number. So that's a place where they are taught and they're told, this, when you see this, fight it. When you see this, fight it. Yes.
But I'm thinking that cancer cells are very strong, and so they know how to hide and pretend like they are also good ones.
Yes.
And that is why when people already have cancer, as much as you try and try and try, if it's already in existence, it will kind of overwhelm you because it's trying to, you know, show a different shade. Like, I am here, but I'm fine. I'm a good one. You don't have to attack me.
Okay. Yeah, it's true. Cancer cells are usually, they start like normal cells, and then they decide that they want to grow beyond what the normal cells usually grow like, because our growth is determined by our DNA. Okay. So that means if this finger is going to grow up to here, it's controlled by the DNA. So now what happens that when the cells become cancerous, they decide that they will not obey that. They go beyond. And that's what happens with cancer. They don't want to listen to the instruction of how the DNA makeup is. Okay? And that's why sometimes they hide, okay, from what you're saying. Okay? Now, that is usually determined by certain things. So, so it can be caused either by chemicals, certain chemicals that when we're exposed to, they go and affect certain cells and affect that communication. So it's like they overwrite that communication and say, no, you're not supposed to grow up to here.
I know.
You can continue growing. Okay, so certain chemicals can do that, and this is why chemicals like what we call benzene that used to be in certain marker pens. When you go to buy a marker pen, usually they will tell you that it doesn't have something called toluene. Toluene is a benzene that was causing leukemia. Okay, so certain chemicals like that, or asbestos. You remember the roof types? Yes, those ones. Yes. So it can be chemicals. Two, it can be viruses, and this is where the human papilloma virus comes in. So then the virus affects the cells in the cervix for the woman. It again rubs that code, and it tells the cells of the cervix, no, whoever told you that you should stop growing, I was lying to you. You guys can continue growing. And
I
that's
wonder
what
how men are able to escape the consequences of carrying this virus and spreading it to the women, and making the women the sufferers and the victims.
The men do not escape, but probably their risk is lower because men also can get cancer from the same virus, because the virus causes warts. Okay, and there's a certain type. It has different types. So the type that actually causes cervical cancer is the one that usually is what we call asymptomatic, meaning for majority of men, they do not know that they have it.
Okay. And what do they call it?
the human papilloma virus,
Yes.
HPV.
Yes. What
Yes.
do they call it in men?
In men, it's the
Yeah.
same. It's the same.
Because
it's the
they
same.
do not have a cervix.
No, it's just human papilloma. Oh, it can cause penile cancer. Yeah, it can cause penile cancer for men.
Okay.
Yes,
It will
yeah.
not cause the prostate. That would
No,
be
not
so
prostate.
different.
Prostate is a different. Prostate
Alright.
cancer is different and is not associated with the virus. Yes, yes, yeah.
All right. So
Yes.
that was such a long intro.
Yes.
I was so shocked to hear that men are actually the ones who spread this virus to the women.
Yes.
And when I try to look at the statistics of the women who have cervical cancer,
Yes.
I can imagine that there is just how many men probably have the virus and have been able to spread this.
Yeah.
It was not a woman making. It was not something that women just came up with.
Yeah.
But so then we are talking about how women can escape.
Yes.
And you had correctly put that for us to get to know how to escape,
Yes.
we need to know then what caused, so
Yes.
that we are not even found close to those causes. So what is it that would cause breast cancer in a woman, so that I don't find myself mingling with the causes and then
Yeah.
come and try fight prevention?
Okay. So interesting enough is that breast cancer is not only limited to women.
Yeah.
Yeah, so both men and women have breast tissue. Only that for women, the breast tissue is dense. Or if I would use the word, it's a lot compared to men.
Yeah.
That's why women have breasts, okay? But men, women therefore are likely to have breast cancer because the breast tissue is dense and it's a lot compared to men. However, when men get breast cancer, it's much more aggressive.
Oh.
Yeah, it's much more.
Despite the size
yes,
of the tissue.
Yes.
Okay.
It's much more aggressive because it spreads faster because the breast tissue is less. It spreads faster. Now, there are certain things that one can change, there are certain things one cannot change.
Yeah.
The things one cannot change are age. So the older you are as a woman, then one is more at risk than a younger woman. Okay.
Okay.
Second is when one starts menstruating and when one finishes menstruation. That's what we call menarche and menopause.
Okay.
So if a woman starts their periods before the age of 12 and finishes their periods after the age of 55, they are more at risk.
Okay. So what is the best?
Because they are exposed to what we call estrogen, the
Yeah.
hormone called estrogen.
Yes.
They're exposed for a longer time. Okay? Yes. So the longer one is exposed to that, then they are more at risk. Okay? The third thing is if there is a genetic, makeup that has the risk for breast cancer. There's something called BRCA gene. Now the BRCA gene, if it is expressed in the family, the likelihood of women getting cancer in that family is 80%.
Okay.
Yes. So it's important sometimes for people to know earlier.
back.
Yeah, because the women who have known about this have decided to remove their breasts early.
Oh, before.
Yeah, before they get a cancer, because 80% of the times they're gonna get it. Okay. So those are things that one cannot change. And then there are things that one can change.
And that cutting of the breasts before is actually a preventive method.
It's a preventive.
For those that are
know
genetically, genetically sure that they will be affected.
Yeah.
All right.
Yeah. Oh, I forgot another one, is that breast cancer actually follows the maternal side. So for a woman or for a man, if on the mother side, the grandmother, the mother had, both of them even had cancer or breast cancer, or even the auntie on the mother side, then the risk is higher.
Oh.
Okay. It doesn't mean that they'll get it, but the risk is higher.
Yeah.
Yes. Okay.
Only maternal.
On the maternal side. Okay.
If it was your paternal auntie, you're safe.
Yeah, the paternal auntie, the risk is very low.
Okay.
Very low.
Okay.
Now, for now, how do you prevent it? That are some of the things that you can change. Those are the things you cannot change. So the things that
you cannot change being a woman.
Yes.
You cannot change your age.
Yes.
Every time the sun rises, you're adding another day.
Yes.
So you cannot change your age. You cannot change your gender.
Yes.
and
the genes.
And the genes.
Yes.
Okay.
Okay. Things one can change.
Yeah.
One is breastfeeding. If you get pregnant and you breastfeed, you reduce your risk compared to somebody who did not breastfeed. Okay, so women who have breastfed actually have a lower risk for breast cancer.
And that breastfeeding is how long? I mean, people are told to breastfeed 6 months exclusively when they
Yes,
get
yes.
children.
Yes.
But when you have had your last baby at 30,
Yeah.
how do you continue breastfeeding after 30?
No, as long as you breastfed in your life.
Oh, all right.
It
Okay,
doesn't have to
okay,
be
okay,
breastfed
okay.
every year. No, as long
cool,
as one.
cool.
So what does that mean? It means one broke the exposure to estrogen. Because see, when a woman gets pregnant, the hormone that maintains the pregnancy is called progesterone.
Yes.
So that means for at least 9 months, they're not exposed to the much estrogen
Yes.
that they're usually exposed to. Make sense?
Yes, yes.
Yes. You've just broken that.
Yes.
So a woman probably who has breastfed and probably has had more children is less at risk.
But don't we have birth controls that are
Now,
estrogen?
that is not the other thing. Also, that is something one can change. So if you use estrogen containing pills, then you reduce your risk.
I wonder
Those
if
you use,
there are any, maybe
like
those
the
talk
monthly
about the
pills.
coil. The monthly pills have
Yes,
estrogen?
those ones have estrogen, yes.
Yeah.
Yeah, the monthly pills have estrogen. Some of the hormonal ones, some of them may have the one for injection, but the one that we recommend for many women is an IUCD. It's easier to go back to fertility, and they don't have complications of hormones.
Yeah.
Okay,
True.
that's the second. So avoiding estrogen-containing pills. Okay. Now the third thing is just regular screening. Yes, if one does regular screening. If you're less than 30, probably, of course, in addition to breast self-examination, one can do ultrasound when the breast tissue is a lot. Above the 40, at least a mammogram. Yes, at least a mammogram.
How would you just do an ultrasound on your breast? You know, Africans, if I'll narrow down to Kenyans, we are prone to seeing the doctor when we have certain symptoms.
Yes.
When I'm just healthy, I don't feel a lump, I don't feel pain, I feel nothing. It's not easy, you know, because we are also not practicing the culture of having medical insurance and things like that. We feel like those are luxuries that we shouldn't have.
Yes.
But even those who are lucky to have them, I don't know whether they are really exposed or aware that this is a practice they should do regularly, as regular as you're saying.
Okay. Because
we don't have those schedules of seeing a doctor monthly or yearly if I am not sick anywhere.
Yeah. So that's the guidelines that every public healthcare system is supposed to advise, especially when it comes to preventing conditions that are public health concern. Now, breast cancer and cervical cancer killed at least 20% of all people who died of cancer last year in Kenya.
Oh my God.
Yeah, so that means
breast cancer?
Yes, and cervical cancer. So that means there are more women who died of cancer compared to men. Yeah. So if you're to take at least 10 people who died of cancer last year, all cancers, 20% of them were due to breast and cervical cancer. Yeah. So very important. So therefore, as a public health system, the idea then therefore is to see and put mechanisms that if you go for your eye checkup, if I'm the medic there, I will ask you, how old are you? Okay, when is the last time you had your
screening?
Yes, yes. Okay.
And screening is basically the pap smear?
But, for cervical cancer, it's pap smear. For breast cancer, we would do a breast examination. And if one is older than 40, then you can do at least a mammogram and have that on record. And also, you also have on record. Okay. But one of the things that I think is very, very important is that people have to embrace and actually see that wellness is part of life. Why do I say this? Communities that embrace wellness live much longer. Much, much longer. If you look at all the countries...
That's very important,
yes.
and I would rather we take a break
okay.
and come back and talk about it
okay.
In a more sober mode.
Okay.
It's very important. We don't need to miss that.
No problem.
So, viewer, we are taking a break. We're talking about wellness and how we can escape cancer, even as women. We are narrowing down to breast cancer and cervical cancer. Please stay with us. Coming back just now.